Let's go to Antoinette in Pretoria. Hi.
Hi there. My ex-husband has all the symptoms that you have spoken about and has recently been diagnosed with bipolar. During our marriage, though, we thought the problem is just alcohol, that he was a binge alcoholic, and that's what I couldn't live with, and eventually had to divorce him because of my kids. So what I wanted to ask you, though, is he's recently come up with a theory that he had some trauma in the army, and that is what sparked it and got him, he couldn't work through that, and that's why he started drinking, and every time he drinks to forget all these things that happened in the past, and, you know, he had not a good childhood. He was really very unfortunate. He didn't have his parents around. He was in foster care. So there are a lot of issues that get to that point. But can it be from those kind of traumas, or is it a physical situation that needs to be controlled with drugs? And he obviously is now on medication for the bipolar aspect of it.
Okay. So, sorry, Antoinette, to interrupt you, but Doc, from what Antoinette is saying, it sounds as if his circumstances were such that any person would get depressed or struggle with life. At which point is it ADHD or simply somebody not being able to cope with the hand of life, basically?
Okay, those traumatic situations could precipitate depression, anxiety, which could be part of ADHD or bipolar. So it could be an isolated, as Rennie says. But the other thing, there's a similarity between ADHD and bipolar. In bipolar, the patients get psychotic or they get grandiose. In ADHD, we don't get psychotic or grandiose. In bipolar, in the manic phase, they're hypersexual. In ADHD, they're hypersexual all the time. In bipolar, if they don't sleep, they get more energized and less tired. In ADHD, if they don't sleep, like when they're on call or something, they get very tired. And in bipolar, the external environment doesn't affect them that much. That means in ADHD, if somebody phones you and tells you something bad, you get upset. If somebody tells you something good, you get excited. In bipolar, if you're manic and somebody says your wife ran away, you say, oh, let her go. Or if you're depressed and somebody says you won a lotto, you say, well, that's okay. It doesn't really fuzz you that much. So these are the similarities and differences. But 15% of the ADHD can switch over to bipolar, and 25% of the bipolar can switch over, comorbidity we call it, to ADHD. So there is a relationship between the two. But your doctor has to determine, I'm sure he's already, about the bipolar symptoms. Many times, patients who have bipolar type 2, which is they have depressed phase, but they don't have any mania or psychosis. These patients were actually ADHD and they were wrongly put in type 2 bipolar diagnosis. But that's not on the TV and the radio. This is for your physician to work out and somebody sort it out at this stage. But he needs treatment either way.
Yeah. Okay, Antoinette, thank you very much for calling.
Thanks very much. Bye.
Bye-bye. Let's go to, and Doc, I do want to explore this further. I mean, I'll take advantage of the fact that you are a psychiatrist, that sometimes you talked about comorbidity.
Morbidity.
Okay. And sometimes, you know, some symptoms are not necessarily unique to only one condition. Our life circumstances also determine how we turn out, isn't it?
Yes, definitely. So, like many of these kids, prior to diagnosing any condition in child psychiatry, we check out if there's been moving from another town, has there been a new school, has there been a death in the family, has there been a divorce, has there been a depressed mom, any of the normal changes. We've got to outrule that first.
Yeah, because you don't want people just diagnosing themselves with ADHD because they're going through a difficult time, or they're not managing money, or they're drinking, or they're going through divorces. It doesn't necessarily mean you've got ADHD. Okay, let's go to Zane in Johannesburg. Hi.
Hello.
Yes.
Hi. How are you?
Fine, thank you, Zane. Welcome.
And greetings to Dr. Jeeva also.
Oh, thank you.
Look, I'm a first-time caller, but nervous. And now what I'm saying is that my son has been diagnosed with bipolar.
Right.
And most of the symptoms that you spoke about in his childhood, well, he's now 27 years old, has been there, manifested, at an early age while he was in school, and he was always keeping to himself, never, having friends and things like that. And at the moment, I think he's on Ritalin at the moment. He has been diagnosed, and he does get medical treatment. So I think a lot of the things you have spoken about actually does apply to him. I don't know, is there any way that we can contact you privately or something?
Sure.
To Dr. Jeeva?
Yeah, we have our website.
Can we give
the website?
The website, and there's an office line as well. I'll put you on hold, and then Nobile can give you the office line as well. Not your cell phone number, but we'll give the office line. Thank you very much, Zane. And let's go to Ray. Ray in Parktown. Hi.
Hi, Redi. How are you?
Fine, thank you, Ray.
Hi to the doctor.
Hi.
I've been listening to the show. At the outset, the doctor made mention that you use the term ADHD and you don't use the term ADD anymore.
Yes.
I'm a professional person, and I've been diagnosed with ADD.
Yes.
I haven't exhibited any of the symptoms that you talk about. Hyperactivity, being naughty at school, any of those sort of difficult characteristics. What I did was I just had trouble concentrating.
Yeah.
Concentrating in class.
Mm-hmm.
And since I've gone on to Concerto,
Mm-hmm.
it's an absolutely miracle drug.
Great.
It's literally, as you mentioned before, it's like putting on glasses when you didn't before.
Mm-hmm.
So I'm saying it's the ADD and ADHD are completely different.
Yeah, let me just make it.
I'm a professional person in terms of reasonably successful, and I didn't feel that there was anything wrong with me. And when my child was diagnosed with ADD, the doctor said quite rightly, like you said. Hello?
Yes, I'm listening.
To you.
Just like you said, that's a genetic thing. I thought, oh well, it sounds exactly like me. Doctor said, well, why don't you go on this? And it's made an unbelievable difference to my life.
Okay, we're happy for you.
Sorry for not clarifying. We did sort of touch on we don't use the ADD term. We say ADHD inattentive type, which in childhood they don't listen, they don't follow through, they can't organize, they lose important things. In adulthood, they have difficulty paying attention, they have difficulty in meetings, reading, paperwork, they procrastinate, they have time management problem, they disorganize, jermakar, poor financial management. So that's the girls type. They're usually kept in the back of the class. They misdiagnose in school, they misdiagnose in high school, in university, they get picked up in marriage and in the work life, and the boss says, you don't know how to pack properly, or you don't know how to cook properly, and why come you late all the time? So that's what it is, and you got the right treatment, and you do a lot of exercise, and you're on your way. Thank you.
Mm-hmm. Is the medication addictive at all? Is there ever a time where you kept to be off it? And I'm thinking here about somebody who's diagnosed with ADD or ADHD early in life and has to be on medication for the rest of their lives. Is that healthy?
The earlier you treat them, the better the results, and some of them have a relatively normal life after their school lives, and at least a third to a half won't continue their medication. So it's the problem if you started late, and a lot of the time we started late is because of the parents' insecurities. They don't want to start the child on medication. We try all the other holistic additional treatments like diet and everything, and that's great. You need it all the time. And when you try it later, by then the comorbidity has set in, like depression, anxiety, substance abuse, and then you got to fish them out. So Russell Barkley, the father of ADHD, says the earlier you treat them, the better the outcome, and the more than likely they lead a relatively normal life after they finish school and university. So earlier treatment is the way to go. We eventually end up treating all the people that start and try everything else, and they come back, and there's place for all kinds of treatment. There's no right treatment, there's no only treatment. The cheapest only treatment is exercise in the world. If you exercise 5 times a day, you won't need your Ritalin or your stimulant.
5 times a day?
Yes.
Why would you want to exercise 5 times a day?
Because if you exercise 5 times a day, it increases your dopamine, your noradrenaline, and in ADHD, these two things are low.
Are you talking about 5-minute exercises or proper exercise? Who's got time to exercise 5 times a day?
J-Lo, she exercises 5 times a day.
Well, she's J-Lo.
But that's why, if you don't exercise 5 times a day, then you exercise as much as you can, and if your exercise doesn't bring up your dopamine and noradrenaline as much as you need, and you keep away from all your stimulating foodstuffs and edibles, then you need to bring in your medication when you're in trouble.
Oh, okay. Imagine that. It's so hard waking up in the morning and just going for a run. If I had to do it 5 times a day,
well, if you come to the gym and you see how these women are pumping iron and doing all these things, you'll be amazed what happens out there.
Yeah. There were some SMSs about medical aids, that the medication is so expensive. Treating ADD, is that covered by medical aid?
Yeah, I hope Discovery is listening to this, because I gave them a presentation about 1.5 years ago appealing to them that please, you treat all the comorbidity, all the medical aids, they treat all the comorbidity of ADHD, that is depression, anxiety, substance abuse, but they won't pay for the medications for the ADHD, which is ridiculous. They could save billions of dollars, because if they allow our patients to get paid for the medication, stimulants en route, half of them won't end up in the end. But they'll pay for the end, but they won't pay for the middle. It's a shame. It's a business advantage for them, not even a medical for us. So we would like them to accept our patients' request for all the medications to be paid. And Discovery is a big one. It's a shame. I'd like somebody to do something and help us, because we got over 9,000 patients and we need Discovery and the other medical aids to pay for it. I mean, this is the most heritable child psychiatry illness, and they pay for depression and anxiety and substance abuse in the end when you're really in trouble. So why don't you pay early and we don't have to fish these guys out of trouble?
Here. Doc, a pleasure chatting to you. Dr. Shabir
Thank
Jeeva.
you.
Thanks indeed.